So good afternoon, as usual, Dr. Solante. First off, what was your reaction to that pool party in Caloocan City that went viral over the weekend?
Yeah, so we were surprised about it, not because that kind of activity is a super spreader event, and we know that we're not yet, in terms of our cases, is not yet stabilized. No? So we need to really again rethink what are we doing? Why are we doing this type of activities at this point of the pandemic? Where cases are still very high.
All right. Again, just to reiterate to the public, Doc, what are the risks associated with this kind of mass gathering? Any fresh warnings or reminders for the public, of course, coming from an infectious disease expert like yourself?
Yeah, we know that most of the cases, surge of cases experienced in the past here in our setting is being mainly driven by these gatherings, especially this type of gatherings where almost nothing or none of the minimum health protocol standard has been complied with. No? And when you have this type of gathering, you know the consequences. And we don't want to let our guards down in terms of this type of activities, because these are again the start of another surge or whatever is that. Please don't be complacent about this type of activities. I know it's summer, it's very hot, but there are other ways of making ourselves comfortable rather than being in this type of mass gathering or people gathering.
Right, loud and clear, Doc. Again, reiterating the maintenance of safety protocols. Let's move on now to vaccine-related issues. The fact that Sinopharm's vaccine, Doc, has already gotten the WHO's emergency use listing. Can we say now that we actually know enough about this Chinese-made jab and its effectivity because the WHO already gave it approval, basically?
Yeah, honestly, if you have a WHO EUL part of that EUL, then you have already one foot in terms of a vaccine that has been validated and passed through that assessment and evaluation. But still, Sean, no, they still need to submit the same documents that we in the government, in the VEP and the FDA requires for them to be fully evaluated and granted the EUA in our own country, even that they have an EUL with the WHO.
That's right. So now what the DOH wants to know, and we just aired the report about that, can the Philippine government or the DOH really process Sinopharm's EUA on its behalf? Is there any reason why the state-run vaccine maker has not submitted requirements as yet that you know of, Doc?
Well, if they can access the documents that were submitted to the WHO, then that could be an important document also, because more or less the requirements, the documents that we reviewed for EUA approval, more or less mirrors that of the WHO. No? But again, what if there are other questions, clarificatory questions that in that documents cannot be answered by those documents? So we need answers coming from the manufacturer itself or for those who did the trial of this particular vaccine.
Right. So thank you for answering our concerns, at least from that front. Now, there's also the angle of it might be a conflict of interest, Dr. Solante, if the DOH submits these documents to the local FDA, which is actually a subordinate agency of the DOH. So do you see any problems with this arrangement moving forward?
That's a big problem because of a conflict interest. You are applying for an EUA of a pharmaceutical, and you're the ones who also be using this vaccine. Definitely, that's where the conflict of interest is.
All right, and we also have noted a slight downward trend in active cases and new cases in the last week or so. Octa Research Group has said that, yes, they are observing the same downtrend, but whether or not this holds will be a different matter altogether. Do you think that cases will go down again to maybe 2,000, 3,000 anytime soon, Doc?
Yeah, that's a good number of cases that we have had for the past week, and it's really downtrending. And I hope we can maintain it, and hopefully we're looking at 2,000, 3,000 in the next week. And if that's the case, then that's good enough that we can open up the lockdown to a more relaxed lockdown quarantine. But again, people should still maintain the minimum health standard protocol wherever you go, in the workplace, in the public transportation, and even in fact at home.
Right. So, Doc, you are hopeful, of course, like you said, that the cases will go down in 2 to 3 weeks, or maybe within the next week, go down to 2,000 to 3,000 cases. Right now, we're still logging in over 6,000 cases to 7,000 cases a day. How would this number drastically half or cut in half within a week?
That's why the monitoring of these cases is very important. And again, with the event that just happened, that particular event in that resort, that's not something that we have to encourage. No, we have to strictly implement the health protocol wherever we are, so to maintain the number of cases going down. So in that way, I'm hopeful that there will be a significant drop in the number of cases. We already felt it in the hospitals, in the healthcare facility, and it's just a matter of time, hopefully, that the cases will really stabilize to 2,000 and 3,000.
All right, thank you as usual for your time. That was Dr. Rontgene Solante, head of the Adult Infectious Diseases Department in San Lazaro Hospital and a member of the vaccine expert panel.